My name's Dr. Eleanor Annan. I was born and raised in Ghana, West Africa, which is, a really small country. I didn't grow up in a culture that acknowledged mental health to a large extent. But I grew up always having a pretty large curiosity about what makes us tick. What are the things that make us make the decisions that we make, the choices that we make? And I attended medical school at Duke University and did my psychiatric training, my residency training at Northwestern Memorial Hospital in Chicago. Growing up, I always, I was exposed to medicine like any other child. There were no medical professionals in my family, but I do have recollections of going to pediatric appointments, going to the hospital when I was ill, going to clinics. And I also have a lot of recollections of various individuals, family members, friends, people I didn't know, struggling with drug abuse, mood disorders, suicidality, and was always quite curious about the way in which we discussed these issues. We talked about these things. In fact, we were not really allowed to talk about these things because they were seen as events or phenomena that brought on a lot of shame to an individual or family member. So if you had a mental illness, it was not to be talked about. It was to be hidden. And if it were to come out, it was something that was going to be denied. I always knew I wanted to, as generic as that might sound, make some kind of an impact, lasting and important impact on individuals' lives. And I originally I moved to the United States to live with my father to attend college after I finished high school in Ghana. And originally started my training in nutrition. I had always been interested in health and medicine to a certain degree, but hadn't quite solidified, a pretty clear enough idea of what I wanted to do with my life. So I studied nutrition and became a nutrition counselor and worked for WIC for a number of years after my undergrad. And during that time, became quite painfully aware of what a problem our obesity epidemic had become, particularly as I was seeing the rates increasing in children, very young children. And so I then decided that I was going to pursue medicine because I thought that was going to be one of the most meaningful ways I could make an impact in that way, help individuals to focus more on health, focus more on healthier eating, focus more on healthier lifestyles, help to reduce this issue, this helped reduce the impact of this problem that we had. Once in medical school, it became pretty apparent pretty quickly that it was hard to ignore the link between trauma, psychological problems, and eating behaviors. And so I decided to pursue a career in psychiatry. And I had always been interested in human behavior in general. I worked in a childhood obesity clinic, and 99.9% of the time, these children were dealing with some form of trauma. And so in medical school, actually, in my last year of medical school, after I had applied for several interviews in pediatrics, I also then decided to interview in psychiatry. And once on the interview trail, I just knew that psychiatry was going to be a better fit for me because it resonated with who I was at the core, which was a very curious individual about human behavior. And it was just really exciting for me to be around people on my interview trail in psychiatry who shared this curiosity.